Hello, everyone. This is Helen C's presentation on my summer 2016 internship with the Children's Cabinet. The Children's Cabinet is a nonprofit agency offering over 30 different programs and services to youth and families. Above is their agency mission statement. The Children's Cabinet works to serve youth from ages birth to 24 years old. They also provide services to parents and families. Some of the special populations they work with are runaway and homeless youth, foster youth, and disabled youth. They mainly provide services to clients in Washoe County, Sparks, and Lemon Valley, but they will also provide services to youth from out of state. For example, this summer, a runaway youth contacted the Safe Place program here in Reno, needing assistance to get back home to Alabama. The Children's Cabinet helped get this youth transportation back to his home state and continued to provide follow-up services. Most of the services offered by the Children's Cabinet are listed here. The ones highlighted in orange were the programs I was able to learn more about in greater detail. The main program I worked with was Safe Place. Safe Place is a national program for youth in crisis which partners with local businesses to provide a safe place for youth to go. Youth can call a 1-800 number that is available 24 hours a day to speak with a Children's Cabinet staff member, who will then make arrangements to assist the youth. For youth who may be homeless, they will be brought to a shelter, which brings me to my public health issue. Many agencies in Washoe County are aware of the runaway and homeless youth population living on the streets of Reno and Washoe County. The Children's Cabinet is working to solve this issue by providing more housing options for youth and opening a transitional living center. The center is scheduled to open in October of 2016 and is currently being renovated on the Northern Nevada Adult Mental Health Facility located on Galletti Way. This building here was donated to the Children's Cabinet and will house 16 beds, 8 male and 8 female. The first objective of my internship was to create a best practices report for shelters serving runaway and homeless youth. I researched these national agencies working with this population and recommended evidence-based programs, approaches, and services to include in their new facility. This objective addressed Competency 3 to demonstrate effective written and oral skills for communicating with different audiences and professional public health activities. My second objective was to create a summary statistics report from the Children's Cabinet internal data. In order to do this, I accessed the HMIS data system, or the Homeless Management Information System, called Clarity Nevada. HMIS is used by providers nationwide to track and record data on the homeless population. I had access to over 900 entries of Children's Cabinet client information and used SAS to calculate summary statistics, odds ratios, and chi-squares. I then presented the findings in a data book and compared Children's Cabinet information to statewide standings from the Nevada Kids Count data book. Here are a few examples of some of the charts and findings I included. I feel that this objective had the most impact on improving the health of the community because the Children's Cabinet has never really done this before, where they examine all of their aggregate data. So I think being able to better define their population can guide them in creating effective programming. Objective 3 was to create the Policies and Procedures Manual for the new Transitional Living Center. All of the policies and procedures need to be in place prior to the opening of the new center. To do this, I worked closely with the program director, coordinator, and the executive director to write, review, and edit the manual. I also toured other similar facilities to see what ideas the Children's Cabinet could benefit from. In the end, we came up with a 15-page document of policies and procedures. This objective helped to accomplish Competency 1, 2, and 3, demonstrating team building, negotiation, and conflict management, appreciating the importance of working collaboratively with diverse communities, and demonstrating effective written and oral skills. Overall, my internship experience was great, and thank you for listening.